And over the years, and the reason that this board is here is part of the reason is because of
Thank you.
Reason over the years, it's hard to keep volunteer EMSs going. That's what Stockdale and David, a few years ago, you can probably tell you the exact times.
This is 4 years ago.
4 years ago, you know, had to close their doors, and we had to look on other directions. And it evolved. There was other things happening, and it got to where there was a place that we could turn to get professional service countywide, quality service countywide, and that was a hospital. And the hospital is, I talked to Mr. Burnside, and he said that he thinks that he can get it done, and so he started with that, and that's where we are right now. I know he's got a whole lot more. He's going to give everybody an insight as to what the hospital is doing. I'm not into that, but I'll let him do that.
Mr. Burnside, go ahead.
Perfect. Well, appreciate the introduction, and good to have everyone here this evening to hear a little bit about this. I know this topic has been out there for quite some time, but this is kind of nice to kind of take the show on the road a little bit and give everyone some insight to what's going on. So my goal for this evening is to share with you a presentation that I've given many times previously. Probably not a lot of brand new information here, but certainly foundational information about what we're talking about. But most importantly, hope to be able to answer some of your questions, some of the board's questions about this vision and where we're going. So I am Brian Burnside again. I'm the CEO of the hospital. I've been here for 3 years. Have really enjoyed the opportunity to make Wilson County the home of my family. And so where we started this whole conversation was the idea that the work that volunteer services and professional services here in Wilson County have done over the years has created an outstanding foundation of care for EMS services locally. We know that over the years you all have woken up in the middle of the night to handle calls, that you've given up your weekends, that you've done a lot of things along those lines to help care for patients in the area. What our goal was, what the conversation began around, was how can we take the foundation that each of the 4 entities have built over the last couple of decades and turn it into what is simply the best EMS service in the state of Texas. How can we make it the best? It might be good, it might be very good, but how can we make it the best? And again, knowing that we have professionals who have been giving of their time and talents at this project over a number of years, we believe that the work you all have done here in ESD 3 and in some of the other areas have created a good foundation for us to build on. So way back in February, we had kind of an introductory conversation with leaders of the EMS groups. I see some of the folks were actually here at that meeting, and we talked about some of the problems that each of the areas were having. Some talk about clinical protocols weren't the same across the county. Some talk about pharmaceuticals going out of date because they weren't used frequently enough, and that was very expensive. Talked about education, the issue that really keeping up your certifications is very difficult, and how could we work together not as 4 separate entities but as a group to try to accomplish some of those things. During that time, the hospital put on, I think many of you participated in some of our education sessions. Sue, what was what we did the other day? There was the pre-hospital trauma certification, right? So we had probably a dozen people participate in that. Done some other trainings over a period of time trying to help with the certification requirements that each of you have. But as we started getting into that a little bit more, I'm a strategic thinker. I think about the future. I think about the long term. That's the job that I have, is not to only think about what does Wilson County look like today, what does Wilson County's healthcare look like today, but what's it going to look like in 3 years, 4 years, 5 years, 10 years as our county continues to grow. And so as I looked at that, I said, you know what, our population is clearly going to expand. That's in every projection that's officially in writing anywhere, is that our population is going to expand. I also knew that from a healthcare standpoint, the pressures on entities like each of the 4 ambulance services were going to continue to grow. Costs were going to continue to be a concern, and it wasn't going to be easy to continue to recruit EMS providers within the area. So we started this idea and said, okay, what could our EMS service look like over a period of time? What could it evolve into? So we laid the vision out to develop and pursue a multi-phase plan to provide standardized emergency services across Wilson County within the next few years with the following goals. These things were all things that came out of those first meetings. Standardized clinical protocols, employment opportunities for EMS personnel, educational opportunities for EMS personnel, reduction of waste and duplication, appropriate response times, long-term planning, not just today planning, but long-term planning, establish quality improvement metrics, and standardized billing and collection. The fact was that if you're a resident of Wilson County, we use this analogy, and I think many of you would agree with this in principle, that if 12 o'clock next Tuesday, a citizen in each of the 4 corners of our county had some type of health-related illness, they would all be treated by good EMS personnel from each of the services. But it's quite possible that the care that they would receive would be very different. Not making a judgment about good or bad, not making a judgment about good or bad, just different. And I think as we started to look at this from a Wilson County perspective, our citizens really would appreciate the opportunity to know that their care would be standardized no matter what their situation was. So the vision became the starting point. I think this map certainly goes without saying. You all are the experts in all of this, but it really drives the point home. Serving the 866 square miles of Wilson County are 4 different ambulance services, 4 different emergency responding services. Certainly ESD 3 here. You all have done a great job. You provide a mobile intensive care unit 24 hours a day, 7 days a week, 365 days a year, and that's what you're licensed to provide the residents of your precinct. That's a great accomplishment. You also obviously are a tax-supported entity just for ambulance. The other 3 organizations each have their own characteristics. Laverne is a mostly volunteer service. ESD number 2 is a tax-supported entity for both fire and EMS. And Wilson County EMS is a mostly volunteer service. That also have different levels of licensure. From a state licensure standpoint, some are licensed as basic life support with occasional MICU. Some are licensed with basic life support with more frequent MICU. So that is a key distinction amongst the 4 different services. So how did we kind of come about this? How did we insert ourselves into this discussion? Well, we've been on a vision for the last number of years, 3 years that I've been there, to make our hospital one of the best hospitals in the state of Texas. And we can all talk about the history of Conley. We know that many of you have had long-term history with the hospital. But I think what is important is who we are today is very different than who we've been in the past. And I really appreciate you nodding because that is such a key statement for people to recognize that where the hospital is going and how we're developing is very, very important, not only for Floresville, for all of Wilson County. So here's our story, just a little bit more so you can kind of recognize how this all fits together. Our hospital board is committed to a strategy called Vision 2020. That was my strategy that came together to say we cannot be successful if we are just Floresville's hospital. We need to be the provider of choice across Wilson County. So over the course of the last few years, you've seen us open clinics in Poth, open clinics in Stockdale, open the urgent care and specialty clinic, staffed also with primary care in Lavernia, and then reopen the North Campus facility, both with pediatrics and primary care. So this was a very purposeful effort on behalf of myself and our board to expand beyond the idea of being Floresville's hospital and to say we are supported by all the tax-paying citizens of Wilson County, so we want to make sure that access to care is available in each of those communities. Just kind of a little bit of a reference point. We are indeed a public entity. We are a Wilson County Memorial Hospital District. We have an elected board of officers, 9 members elected by each of the precincts across the county. And we do receive a certain amount of tax support. We'll probably talk a little bit about that in the future here as we go. But as a point of reference, the tax support that we receive has been reduced over the course of the last 4 years, from 2012 to 2016, and it totals about $3 million of a $100 million budget. So we certainly know that the tax support that we receive allows us to invest in capital, invest in physician recruitment, invest in clinic development, and that is a key part of why we have been able to expand our services beyond just Floresville, but by bringing services to other communities. I think probably the most important part of that slide, though, and I think if you've been in this area for a while and if you've seen our growth, is that we've brought in a number of outstanding physicians. You know, I think that when you go down this list of Dr. Hassan, our gastroenterologist, he's incredible. He's done a wonderful, wonderful job with his patients. Dr. Santiago Hospitalist, Dr. Brandon, the ER, Dr. Layla Peterson, she operates at the North Campus, an outstanding family practitioner. Her practice has grown very, very rapidly. Dr. Faulkner, ENT, he's world class. He's been involved in military care in Germany. He's been just an outstanding surgeon for us, and he is literally recognized in the literature as one of the premier ENTs, not only in Texas but in the country. Ms. Hoshek, a nurse practitioner, Dr. Nyack, a cardiologist. Many of you here in Stockdale have probably met Dr. Ekmark. He serves as the team doctor here of the Brahmas. His practice as a family practitioner has grown very rapidly because he cares so much about his patients. Mike Nesbitt serves at the urgent care. Liz Herna serves at Poth. Dr. Profena, who is our hyperbaric and wound care doc. Dr. Krause, an orthopedist who is from the area, does a great job in caring for orthopedic injuries. Dr. Hambrick is out of Seguin, but he comes down and does some general surgery work for us to support our own general surgeon full-time, who is Dr. Preston Moorhead. You see him there with the goatee, and his wife, Charlie Ann Moorhead, who's from the area and is our pediatrician who just joined us. Dr. Kella is a urologist, and Dr. Blond is one of our hospitalists. So my point in throwing that slide up is that if you think of Conley Memorial as Floresville's hospital, or you think that we have not been aggressively recruiting physicians to join us full-time and expand the services that we're able to offer, I really want to share that image with you of that great team of physicians that are changing how care is provided at Conley. That's a big part of our commitment in not just being Floresville's hospital, but being the largest healthcare provider across Wilson County. Judge, I know one of the things you've noticed about the hospital is that growth, is that investment in physicians, is that ability to bring some great docs to the community. Would you like to comment on that?
Well, everybody has had the same stigma that's been around Wilson County forever about it's not the Conley Memorial Center, but the old Wilson County Memorial Hospital. That's changed. It's changed to me. I was in the hospital for a couple of weeks one time, and I thought I got better care there than I did at the Baptist Care Hospital. So it's come a long, long way. And I'm proud of it.
We are too. Thank you. And, you know, again, I don't know that it's worthy to throw out some of our recognitions, but I think I would be remiss if I didn't. I don't believe that we become a great hospital without having a great team. And one of the things that I'm very proud of is that in 2015, we were recognized as one of 150 great places to work in healthcare across the nation by Becker's Hospital Review. They looked at our quality, they looked at our culture, they looked at our service, and they said, Conley, you are a great small hospital, and we want to recognize you as a great place to work in healthcare. I feel that if we have a satisfied team of nurses, of staff, you know, someday of EMTs, satisfied EMTs who are doing great work, paramedics, we're going to continue to be a great place to work. But what that allows us to do is to focus on patient care. Press Ganey is literally the nation's largest surveyor of patient outcomes, and they've put us in the top 5% of the nation in terms of our inpatient care. So if you ever are in the situation where you're going to receive an overnight stay at the hospital, you are getting really some of the best service and care from our nurses that you would find anywhere in the nation. Literally top 5%. And Sue Tackett, our Chief Nursing Officer, is someone who deserves a tremendous amount of respect for her work in making that happen. Thank you, Sue. Good job. You know, don't want to take everyone else's words for it. The most important group of people who judge hospitals is Medicare, right? I mean, Medicare is the largest purchaser of health care across the nation, and they have a website called Hospital Compare, and they recognized Conley as a 4-star hospital in July of 2016. They look at quality scores, they look at service scores, they look at outcomes, and they recognized us in July of 2016 as a 4-star hospital. I'd like everyone to really know what that means. This is very important that you know what a 4-star hospital means. Across the nation, there were only 2.5% of hospitals. Only 2.5% of hospitals were rated 5-star, and only 24% of hospitals were rated 4-star. So vis-a-vis that certainly suggests that Conley's in the top 26% of hospitals according to Medicare's Hospital Compare website. That's a big deal, folks. That is a big deal. We can all have our stories, we can all have our history, but when Medicare looks at our outcomes, looks at our quality, and looks at our service, and rates us as a 4-star hospital, that's the facts. That is absolutely the facts. Here's another interesting topic, and I'm trying to work my way through some of the questions that were asked. This is important because I've heard a lot of dialogue about, well, Conley would be fine if it just would become a level 1 trauma center, or Conley would be this if it would just become something else. And we went to the Texas Department of State Health Services, and we went to the STRAC website because we wanted to talk about, we wanted to understand, you know, what does it mean to be a level 4 trauma center? We knew what it meant, what it means. But, you know, what is the scope of this myth that every other hospital in the area is somehow a level 1 trauma center? It's not accurate, folks. If you go to the STRAC website today, you will see this list of hospitals. I highlighted Conley Memorial Medical Center. We are a level 4 trauma center. Level 1 facilities, SAMC, certainly a great hospital. They have the resources to be a level 1 trauma center. So does University. Those are the 2 level 1 trauma centers in the area. It's interesting to note that North Central Baptist is level 3. The Children's Hospital of San Antonio is level 3. And Methodist Hospital is also level 3. Those are, you know, big facilities with specialized care. But look at the list of everyone else. When we start talking about Mission Trail and Baptist being a level 4, Northeast Baptist, St. Luke's Baptist, Christus Santa Rosa, DeMitt, Frio, Gonzales, Guadalupe, Hill Country Memorial, Nix Hospital, Southwest General, South Texas Regional Medical Center. Each of the facilities have the same designation that Conley does. Conley has the same designation as each of those facilities. Absolutely, everyone provides different services, but as a level 4 trauma center, we are certainly right on par with every other facility in the area. And I think that's a clear designation that we want to make sure is clarified. So as we start to dig into the EMS situation a little bit more, I mentioned to you already that across the county there are 4 services. You all know that. But again, I'm not thinking only about today. What my strength is to think about tomorrow and the years ahead. So again, we pulled some more data from the Texas Department of State Health Services licensing website. They had one study on there about population. In 2010-2015, Wilson County population grew, according to them, from 45,000 to 49,000. But the number of EMS licensed personnel that they had in Wilson County declined from 235 down to 223. You know, is that a significant decline? I'm not saying that it is or isn't, but certainly it's opposite the direction of the population growth. I think that's probably because you know, it's hard to maintain your certifications. It's hard to get those education courses done. So probably some folks have let their license lapse. But also on the website, you guys are probably already familiar with this. They have the rosters of each of the services listed. And I thought it was interesting that when you add up all the rosters per the Texas Licensing Board, there's 79 licensed EMS personnel assigned to each of the rosters. Again, you'll hear it ESD 3 leading the area with 55% paramedics. The other services have 30 to 32%. But what I thought was really interesting was when you looked at the rosters, you could divide everyone out by are they coming and living in Wilson County, or are they coming to serve the county from outside the county? You guys probably really deal with this with your proximity to Seguin. But only 46% of the 79 licensed folks live in Wilson County. That actually only 36 people who practice with each of the existing rosters reside in Wilson County. We had a similar problem like this when we were looking at nursing. There was a period of time when nurses were leaving Wilson County to go work in San Antonio because they could make more money. They had the opportunity to you know, work in a different environment, and they were choosing to live here but apply their trade somewhere else. I think we have the same problem here, and this is why the county, one of the reasons why the countywide paid service may be helpful. We have a great resource of 223 licensed personnel in the area. Only 36 are choosing to work with each of the rosters. So theoretically, if we are able to offer paid positions across the county, we can probably stabilize our workforce of EMS personnel. That's, I think, a very, very important slide that illustrates that stability is a major, major issue for us. Stability is a major issue for us over the period of years. So, much has been made about all this. We can certainly talk about what our plan is. You know, a person could say, well, should we